This is a Geek Leader podcast, and I'm your host, John Rauda. This show is all about helping us grow as leaders, become better technologists, and improve our lives both at work and at home. I hope you enjoy the show and learn a lot. Welcome to a Geek Leader podcast. I'm your host, John Rauda. And if you could, please do me a favor and take a moment and leave a rating and review in whatever podcast player you're listening to this on, whether it's Apple Podcasts, Spotify, iHeartRadio, doesn't matter. I would greatly appreciate it. And that feedback really helps get other listeners to the show. Also, if you're not subscribed, go ahead and subscribe so you don't miss an episode. And if you feel so inclined, you can go to geekleader.com/tip and donate to the show. Thanks so much. All right, Geek Leaders. Today I'm honored to have Dr. Ron Razmi on the show. He is the author of a new book called AI Doctor, The Rise of Artificial Intelligence in Healthcare. He's also the founder of Zoe Capital, which is a group that focuses on healthcare. So it's all about health today, but also with AI sprinkled in, which is really exciting for me. I'm super interested in this. Anyway, with all that being said, Ron, welcome to the show.
Thank you very much. It's an honor to be here, fan of the show, and now I get to be on it.
Awesome. So tell us a little bit about your background and how you got to where you are today and what that shift was between, cardiovascular doctor to software.
Yeah, it has been a convoluted journey. So I'm a cardiologist by background, but when I was doing my medical training at the Mayo Clinic, there was this new thing called emerging technologies, and NIH had a grant to train some of the trainees around the country in this new thing, which at the time meant nothing, but it was digital computer science, data science, training some physicians on it, and I ended up getting on that and training in digital technologies while I was finishing my cardiology training. And that led to being involved in developing the initial software sequences for doing cardiovascular MRI imaging, which at the time MRI was considered a great tool for the brain and the spine. But because the heart moves, it's beating, it was considered impractical to use MRI for cardiac imaging. We developed the software sequences that allowed MRI to be used in cardiac imaging, and actually MRI is the best tool to do cardiac imaging because it's much more clear. The pictures are much more clear and so forth than what's typically used. That really launched me into technology development for healthcare purposes. At some point, I realized that a lot of the decisions about what technologies to develop, adopt, were being made by non-medical people who didn't have medical training. And I didn't want other people to be making those decisions for me. So I went back to business school, got an MBA. I joined McKinsey and worked in their healthcare corporate finance group for a few years before I started a digital health company called Acupera. Moved from New York to San Francisco, and for the next 6 years ran the company. And the company created software that allowed medical centers to start managing their patient populations more proactively. Rather than waiting for them to come in with issues, this would analyze their data and figure out who was high risk, how to intervene to lower that risk, and with lower cost because you were getting to people before they develop problems, and the new paradigm for healthcare, which hasn't taken hold yet because all the economic incentives are not aligned. So after we exited that business, I moved back to New York and started looking at what we got right, what we got wrong about the adoption of digital technologies in healthcare. That research led to writing the book, but also coming up with the thesis for the fund we launched Zoe Capital to invest in digital technologies, especially AI in healthcare.
So when you talk about the financial incentives, I assume that's probably insurance not wanting to pay for it until it's a problem, which is one of those things that I always get hung up on when it comes to healthcare is that, preventative health, knowing about things beforehand and fixing them is usually cheaper in the long run than waiting until there's a problem and surgery is required. Is that not accurate?
It's accurate, but if you do that, medical centers and so forth could stand to lose a lot of money from unused services. So that's why I was saying the economic models are not exactly aligned yet.
Yeah.
Also, let me also say this. It's extremely difficult to change the paradigm. I mean, managing patients outside of the medical setting is really difficult because now you're talking about interacting with people in their daily lives. And that's very difficult.
Yeah.
So even the best run programs have faced the issue that after a few weeks, patients lose interest and they don't want to be called anymore. They don't want to be harassed about taking their medications and showing up to their appointments and checking their weight and that kind of thing. It looks like there's difficulty in incorporating this into people's lives on an ongoing basis. And to change outcomes, it needs to be an ongoing thing. If you eat healthy for 3 months, 6 months, that's great. But if you go back to your old habits for the next few decades, that's really going to be what's going to reflect in your outcomes, not the 6 months that you ate healthy.
Yeah. I know some people that actually go so far to that extreme where they know they have their annual physical coming up. And like for the next 2 weeks, they'll eat like super clean, like no fast food, no, just salads only or whatever for about 2 weeks. And then they'll go to their annual physical. I'm like, what does that do for you? That's like a trick. You're trying to trick them instead of finding out what's really there.
Let me also say that I do the same thing because I want to feel better about myself when I see my numbers. However, the bad news is that if you haven't been eating healthy for a while, eating healthy for the 2 weeks or a month may have a small effect, but your numbers are going to reflect your unhealthy lifestyle from the past year.
Yeah.
Eating healthy for a month may improve it just a little bit.
Yeah. But not enough to actually make you healthy.
Not enough to make you healthy or even make you feel healthy, because if sort of you've been eating a lot of red meat and saturated fat, and now you're getting your annual cholesterol done, the fact that you ate healthy for a month will take the edge off, but it'll reflect your eating from the past year. Yeah. If you start eating healthy 3-4 months and stick to it for 3-4 months prior to your appointment and stick to it, then you could see a noticeable difference in your numbers. Obviously, that's going to change the day after your appointment when you go back to eating unhealthy stuff.
Yeah, for sure. Go ahead.
So I was going to say changing lifelong habits is hard. What we've learned from the first decade of digital health is that technology could take you so far, like having a wearable, having feedback, a feedback loop and so forth could help, but it doesn't seem to be enough to completely course correct.
No, that makes perfect sense. And, I think it helps, me be motivated. Like when I see my watch and I look at it and I can see like how many, fitness minutes I have or how many active calories that I've burned, and I'm close to, my goal and I didn't quite get there. I'm going to do something to get there. I'm encouraged to get there. But you're right. It's not going to take me all the way. It's not going to, prevent me from, eating that late night snack if I'm feeling hungry.
Yeah, and also, so for example, because I wear an Apple Watch, I monitor. I live in New York City. I don't drive. I walk to 80 to 90% of my activities are done through walking.
Mm-hmm.
I can't say that like if I look down on my watch and I've only walked 2,000 steps, I can really cancel my meetings and all the stuff that's keeping me in my chair that day and go start walking.
Right.
There's something about like the demands in your life from other things, from your job, your family, everything else, that's keeping people from living healthier. And having a wearable on, providing some feedback is good. It could be motivating initially, but it looks like the force of your life takes over unless you completely redesign your life to open up space for being healthy, exercise, unless you redesign how you're eating and stick to it. Having the feedback seems to not carry you long term. Like it doesn't result in life. If everything else, if the demands on your time and so forth are otherwise not changed.
Yeah, that makes perfect sense. So getting back to how can AI help us with this then? Like what's the future of AI in healthcare and where is it now?
Yeah, so first of all, it's in its infancy. Most doctors you speak with or nurses or most people haven't come in contact with an AI application in healthcare. So, but AI is very well suited for healthcare. Mm-hmm. So, as a doctor, what I did is I looked at data, I figured out what it meant, and I did something as a result of my interpretation of that data. AI is extremely good at this, which is if you give it complete and accurate data, it can figure out what it means and help facilitate the next step. So in that sense, it's a technology well suited to address a lot of the issues in healthcare. What are the issues in healthcare? We don't have enough resources to take care of people the right way. For example, mental health. We talked about chronic disease management, that kind of thing. A lot of this comes down to not having enough resources, not having enough people to perform all the activities that need to be done. So if you have a resource, a technology resource that could take some of this off your have ongoing engagement and that kind of thing. So in that sense, AI is a perfect technology to address a lot of the unmet need in healthcare. However, in order for that to happen, some things need to fall in place. You need to have unified patient records, which we certainly do not have right now. Your data sits in different providers and doctors and medical centers. So incomplete data in healthcare is a no-go. If AI is going to analyze the data and figure out what's going on and help providers manage you better, it needs complete data, it needs accurate data, it needs up-to-date data. Therefore, until we solve that problem, a lot of these use cases are not going to be happening. Also, integrating it into existing technology stack, existing workflows is really important. And so far, a lot of these tools that have been developed work in the lab, but when you bring them into the real world, they have a hard time replicating their performance in the lab.
Is that because of like the variables that go into like the human body and just everybody's so different? Or is it more about the process?
I mean, yeah, it's about the process. Think about it. Like AI could read a CAT scan and equal a human accuracy or exceed it for small lesions or things that the radiologist could miss. But if you're bringing it and putting it into the setting of a hospital, it needs to connect with the radiology system. It needs to connect with the electronic health record. Mm-hmm. There is the issue of the cloud. A lot of these algorithms sit in the cloud. You need to extract the images from the medical center, send them to the cloud, and then have the algorithm read it and then send it back, annotate it and so forth. This, medical centers are coming into the information age slowly. They don't necessarily have these private clouds set up. They don't necessarily have all this infrastructure. Also, it needs to happen in a timely manner where the output is delivered to the people involved. With the care of the patient. So if the output gets to them later after they've seen the patient and stuff, it's not going to fit into the workflow. So with all of this stuff, this is challenging.
Mm-hmm.
This is challenging, and a lot of adjacent issues need to be solved in order for a solution to stand up for a specific use case. And
yeah, I guess
since AI is not plug and play, each use case has to be stood up on its own.
Yeah, for sure. And I think, when I look at the challenges that are out there, you mentioned integrating with the systems that are doing, let's say, the imaging or whatever. I have a friend that works for a healthcare company where they create software for imaging machines. And a lot of those are running very, I want to say old, but legacy technologies, because it's difficult to get approvals, to use the newer technology on those machines.
Yes, and a lot of times you have to stand in line because the IT departments in these medical centers are understaffed. Mm-hmm. They have a lot to do. So you need to get in line for your application to go through the appropriate implementation, the right interfaces are created, and so forth. If you're AI, you're going to need data. If you're an AI-based solution, you need data. That data is going to come from the existing information system. So you need to potentially connect with 2-3 different information systems within these medical centers. And these medical centers have very archaic technology stacks.
Yeah, and knowing the historical data of the patient is also super important. I could think back to, I had an MRI on my knee. I tore my ACL for the second time in 3 years this past summer. And when, the MRI came back, the technician that was reading it immediately said, "Oh, your meniscus is torn in these spots." And then my doctor, who, did the surgery, looked at it and says, "Well, that's not really a tear there. Those are stitches from where we stitched it up, a few months ago." And it just looks like a tear. But because he knows my medical history because he did the surgery, he knows that those items that look like tears are actually stitches. Whereas if you didn't have that historical context or that data implemented, the AI would also have the same conclusion that the rad tech did, which tore your meniscus again.
Yeah, and we're not anywhere close to having models that can review your previous MRI, look at the new MRI, and comment on whether, there's any new changes or not. It's very doable, but right now, the first generation of radiology applications are about reading a single file, mm-hmm. because that's what's available. That's what's easy is, you come in, you might have a stroke, you're in the emergency room, your scan could potentially be at the bottom of the pile before the radiologists get to it. Meanwhile, the stroke is doing damage to your brain. But if you have an AI algorithm that reads any CAT scans that are marked as rule out stroke, the AI algorithm could read it, alert the radiologist, alert the stroke team to take immediate action. That's a use case that's currently live in a bunch of medical centers through the vendor Viz.ai, and it's realistic. Now, the AI could read an old stroke and think it's a new stroke. And in that situation, that's a false positive, but that's better than, missing somebody or delaying care for somebody who has an active stroke. So those are some of the shortfalls of current algorithms and technologies, but there's nothing that says AI can't be trained to find new lesions after it reviews the previous scan. However, the main obstacle, the main bottleneck for that right now is the fact that the previous scan needs to be available.
Mm.
You might have had your previous scan done in a different medical center.
Right. Especially for stroke victims, because that's not really something you plan. So you may be out of town or somewhere else, so you don't have that information shared or connected.
Yeah, and I live here in New York. I usually get my care at NYU, but for some of the other stuff, I go to Weill Cornell.
Mm-hmm.
And then I had a severe accident on my bike in September. They loaded me up in an ambulance and took me to Harlem Hospital. And Harlem had none of my records, right? Like they had nothing. And then when I saw my primary care physician for my annual physical in December, he knew nothing about my accident. So there you go.
Mm. Yeah. So how are we solving as a nation this data, connectivity problem?
There's been a push for interoperability between these different medical records, like electronic health records from different medical centers and so forth. I think, since I've been on the ground floor of digital health since 2011, when I started Acupera, and I've heard all the talk about interoperability, government mandates, legislations, guidelines, and so forth, and I've seen little progress.
Mm-hmm.
I've become skeptical that interoperability is the way to go. It looks like there are too many spokes to connect to each other through interoperability. The real solution might be creating a national medical record that and creating national medical ID for everybody. So no matter where you get care, they're connected to this central database, and anything you get done gets also dumped into that database. So that solves the problem of having to connect every provider. That, one-to-one connection between different providers seems like a daunting task and not really doable. So we've been working on it for a decade and a half. I don't see a lot of progress. I see some progress, but it seems to me like we need to think bigger, big picture, putting it all together and saying this is really, so it requires a government-based solution, and something that can ensure, mandate every provider to connect, and anywhere where you get care through that number, we know that it's you.
Mm. Yeah, I feel like that should have already happened. You look back, we have Carfax, right? And it kind of does that for cars, where it kind of links up the medical history of the vehicle, like any accidents that they've been in. But do you think the privacy concerns of that, or potential, sharing of data, it could be a cause that's slowing that down?
No, the real reason is the business models of health systems and electronic health record companies and stuff is in hoarding your data. If your data is yours and portable, you're less likely to go back to the same medical center. So one of the realities of our country is the fact that big money has a lot of influence over our politics, and common sense things such as, gun legislation, those types of things that all the other advanced countries have solved, like universal healthcare, that kind of thing. We haven't been able to do it because sort of the private sector interest has too much influence over our public policy. Therefore, they've successfully kept this kind of legislation from passing that says, let's create a national medical record. Because if you think about it, the privacy issues are much more salient if your data is being transferred or being sent from one hub to the next hub, right? In that transit of data is where usually things get compromised and it's easier to hack and stuff. That's probably a bigger privacy concern than creating a central national database, which France has done, Canada has done, a lot of countries have done, and it allows any provider that's managing you to have access to all your data. And in healthcare, having full data is really important.
Yeah, for sure. So other than this data issue, what else do we need to solve to really get AI, helping out and making a bigger impact with our daily healthcare?
Yeah, I mean, I think one of the issues that comes to mind is a lot of the data in healthcare is in unstructured format, like narratives.
Mm-hmm.
And doctors write their notes any way they want. There are no standards. They use a lot of acronyms and abbreviations and so forth, which makes this data very difficult to analyze. So one of the things that I've sort of come to realize is, in order, you have this technology that can help us uncover issues, could help us accelerate research to find new treatments, causes of disease, figuring out how our genetics and other things impact our health, potentially could help us eat healthier, personalized fitness programs, that kind of thing. But it can't do all of this stuff because the data is in different formats, different languages, and so forth. So aggregating that data is one thing, but also making sure that data is in a format that makes it usable is really important. For example, AI can help in drug discovery, but a lot of the historical data, drug discovery data is sitting in these lab notebooks written by hand. That's not usable. So we need to come up with new standards in how doctors write their notes or radiology reports are created, or R&D is collected. R&D data is collected in a way that makes it easy for AI to analyze that data. If we work backwards from AI to how we collect that data, we can really accelerate this process. So I think that's once again becomes national standards. It requires public policy. It requires medical organizations to lobby the government and so forth. So the data doesn't need, like a lot of, like right now, drug data, like pharmaceuticals and stuff, could be coded in different languages. First data bank is the language, then you have other languages. So the first step is unifying the data in one language before you can analyze them. And some of the cloud providers like Google, Microsoft, are incorporating these services into their cloud in order to make their clouds more value add for the healthcare sector, which means no matter what language your data comes in, we'll translate it into a common language, which makes it ready for analysis. I think that's another thing that needs to be done, which, if it sounds daunting, it is daunting, but it's doable. It's doable. So when Newsweek interviewed me for the article they did on my book, I was happy when the article came out that the reporter who was working on the article gave it the title that within a few decades, AI could help us unlock the secrets to the human body. It's going to take that long. It's not a matter of months or years. It's going to take decades for us to solve these issues, and then we can turn AI loose on all that data, and it can find relationships, it can find causes of diseases, it can predict disease decades ahead of time. But to get there, we have to solve a whole lot of unsexy issues that are holding us back.
Yeah. So with that, what's the future? Like, you mentioned a couple of decades away. What's the shorter term future for people?
Yeah,
it's hard to look a couple of decades away. What does the next 5 years bring?
So in my book, I talk about immediate use cases, medium-term use cases, and long-term use cases. So some of the things we've talked about here, like drug discovery and clinical decision support, requires unified data. You can't have missing data in different languages and so forth. Those are long-term. And also with those, since you're dealing with life and death, you have to be absolutely sure. So you have to solve those problems completely before you can engage AI. But there are immediate use cases in administration and operations, taking care of busy work, monitoring patients in hospitals or in their homes using AI non-invasively without using cameras or wearables, using radar and infrared that emits signals, and the signal that it gets back from inside the room, it can analyze that signal and figure out patient's movement pattern, any issues that might be percolating and exhibiting in their movement patterns and so forth. So there are immediate use cases that doesn't require all the data, all the historic data, and it could serve as an assistant in documentation, operations, monitoring patients, and so forth, and provide immediate benefits. And lest anybody poo-poos these use cases because they don't result in curing cancer immediately, right now, our healthcare system and the global healthcare system is suffering from a real shortage of resources. Yeah. That's really the number one problem. So if AI could immediately help a doctor save a few hours a day in documentation or placing orders, doing administrative stuff, help a medical center analyzing their coding practices and submit claims, and help payers analyze those claims and make decisions about payment and prior authorization faster. Those are huge benefits. They open up breathing rooms for all the other stuff, and can also show benefits to the users, so they don't say, look, I hear about this AI, but I never see any benefit from it. That could pave the way for the next generation of use cases in a few years, where we've made progress with data issues and so forth, and we can start getting into lower risk clinical use cases, or using wearable and apps data to advise patients about eating healthier and that sort of thing, healthier lifestyles. And then you get into the longer term use cases that will take a decade or 2 decades and so forth. But I think if we start with what's possible today, given our current infrastructure and workflows and so forth, you can engender good feelings in the medical community that's been traumatized by EHRs over the last decade, where they went, from quickly writing notes to having to type everything. So the medical community is skeptical of technology. They haven't seen benefits from it. It hasn't made their lives easier. Therefore, you really need to show them real benefit that makes their lives better for them to embrace any new technology. They're tired of technology being forced on them that makes their lives more difficult.
Right. Yeah, I think you're absolutely right. And, part of that could just be, like you mentioned before, about the doctor's notes not being uniform. Let's just start there. Start somewhere that we can see an immediate impact.
I tell people there is no best place to start. Let's solve one problem at a time. And this issue of creating standards for data collection and unifying data, that's a good problem for us to solve over the coming years. And that makes everything else possible. So focusing our discussions on things that immediately need to be addressed, rather than sort of what you hear out there is AI is going to cure cancer. It's going to make people healthier and so forth. And what I wanted to do with my book, was get down into the nitty gritty issues that makes this possible long term and are serving as barriers right now.
Yeah. And that's the thing. AI kind of gets a bad rap because, everybody says it's going to happen like right away, but it takes a long time. And we look back on self-driving cars in, 2016, Tesla launched the term, fully self-driving, and it's still in beta. It's still not there. If I had to guess, 10 years from now is when we'll be, fully having it.
Yeah. Although I saw self-driving cars in San Francisco 2 months ago, and
the Waymos
on the road, picking people up, dropping them off, and you don't see a driver, and it's a new experience when you see it.
Yeah, yeah. And they're pretty good, but they're only good in cities that have well-defined streets and signage. When you get out to the country where there's no painted lines on the road, it gets a little bit tricky.
Yeah, and going back to what we were just saying a minute ago, if we start with the immediate use cases, things that are possible, that's a good place to start. We don't need to solve every use case immediately. So I think what happens with any new technology, you have a lot of hype. You have a lot of people who talk about the promise of that technology. People hear it and assume that's around the corner. And when they don't see it, they start dismissing it. And what I'm trying to do with Health AI is ground everybody on sort of what's possible immediately, what issues need to be solved, rather than engaging in this sort of aspirational talk about what AI is going to do, in terms of disease management, finding new treatments, discovering things that we don't even know about. That's going to happen, but it's going to take time. And we should not be creating unrealistic expectations.
Yeah, I agree completely. Ron, this has been a great conversation. How can people connect with you online, pick up a copy of your book, and learn more about AI and healthcare?
Yeah, we can. So if people go to zoecap.com, that's our company website, there's a link to the book landing page where there's information about the book, and there are links there where they can go buy it on Amazon or wherever they buy their books. And the few things that I'll say about the book, I tried very hard to write it in non-technical language, so anybody could pick it up and read and understand the issues that we're talking about. It's goes through all of these barriers that we've discussed, but also discusses the drivers, such as shortage of resources and so forth, things that makes people open to adopting this new technology. It goes through current use cases and what's being developed. And the last part of the book is about the business case for AI in healthcare and why people would buy it, why people would invest in it or spend years of their lives developing technology. And it goes through this tech conversation we just had on what are the immediate use cases where if you have something, people are lined up and ready to use it, and what's more midterm and long term. So hopefully, it's more of a sober discussion of the promise, but also, all the issues that need to be solved to get there.
Yeah, I think that's a really good start and a really good place to go. I'll link people to in the show notes at geekleader.com so they can go to there and go to your landing page that you mentioned at ZoeCap. And again, Ron, thanks so much for coming on the show. Really appreciate it. Thank
you for having me. It's great. It's great to talk with you.
Hope you enjoyed the show. Please go to geekleader.com to learn more about what this guest is up to. Click on their links and connect with them online. I would also greatly appreciate it if you could leave me a rating and review in Apple Podcasts or wherever you listen to the show. And make sure you've subscribed if you haven't already. And if you feel so inclined, you can leave me a tip by going to geekleader.com/tip.